For more than a decade, Ipas Bolivia focused its work on the implementation of health services that assist women with incomplete abortions. This was because the Bolivian Criminal Code only allowed abortions through a judicial authorization, a fact that made it very difficult, if not impossible, to access a legal abortion. On March 13, 2012, Ipas Bolivia, in partnership with Congresswoman Patricia Mancilla, a national representative of the ruling party, presented a constitutional motion to decriminalize abortion. And on February 5, 2014, the Bolivian Plurinational Constitutional Court issued Plurinational Constitutional Ruling 206/2014, which eliminated the judicial authorization to have access to a legal abortion when pregnancy results from rape, statutory rape, incest, or abduction, and when the pregnancy endangers the life or health of the woman. This ruling became the fundamental legal framework to accomplish our institutional mission, promoting women's access to safe and legal abortion. This is bearing in mind that in Bolivia, about 185 abortions are performed daily in unsafe conditions, and unsafe abortion is the third leading cause of maternal death. The first analysis we made as a team was that, at a first stage, we had to work on the offer, preparing the response to the demand that the socialization of the constitutional ruling would generate. This response needed to include timely, comprehensive, and quality services. At this point in time, Ipas Bolivia identified many barriers for women to access safe abortions. These barriers were caused by socio-cultural obstacles and prejudices, the stigma abortion generates, and the lack of knowledge or implementation of national legislation by government institutions designed to implement policies related to violence and abortion. These causes meant that during 2015 and 2016, Ipas Bolivia had to work to promote access to safe abortion in an integrated and synergistic manner, not only through the supply, but also the demand, throughout the areas of health, community access, policy, and communication. Various strategies were implemented in partnership with strategic governmental actors who came in close coordination at different points of the intervention. These efforts were supported by a transversal communication strategy with a rights, gender, and intercultural perspective. With this comprehensive vision, the objective has been and continues to be to overcome all barriers that may influence compliance with the law and therefore access to legal abortion in the Bolivian health system. From this perspective, the health service becomes the core that energizes and defines the work of the four areas. Hospitals we worked with were identified and synergistic actions were planned by policy, community access, and communications to reach key audiences in the areas surrounding these hospitals. In the health area, providers in the health services intervened. In Bolivia's 6 departments were sensitized. This increased the number of health professionals willing to provide comprehensive abortion care with adequate technology. Equipment and supplies were also provided to these health services. Different types of training were carried out with healthcare providers who are either directly or indirectly involved in service delivery, focusing on the comprehensive care model that includes values clarification and attitude transformation, the attention victims of sexual violence should receive before and after the first 72 hours, STD and HIV/AIDS prevention, legal abortion, emergency and post-abortion contraception, post-traumatic stress disorder, and clinical competency training. With these tools, health professionals are trained to provide quality, comprehensive abortion services to Bolivian women. All activities mentioned in the health area would not bear fruit without a continuous sustained intervention through training supervisions and medical monitoring, which is how we promote quality services. We would like to point out that North Carolina's health area had a very important supporting role. In the community access area, it's been instrumental to work and achieve strategic alliances with indigenous, social, and productive women's organizations to raise awareness and inform them on the decriminalization of abortion and their sexual and reproductive rights. These groups are a real support in the advocacy of abortion. Community Access has also carried out a continuous process of empowerment and capacity building of women and men from community organizations that are located around or close to the health services on issues of sexual and reproductive rights, unintended unwanted pregnancy prevention, access to legal abortion, training of spokespersons, and the scope of the constitutional ruling and its importance in the exercise of their rights. These interventions have contributed in the reduction of the social stigma attached to abortion, overcoming barriers of sexism and discrimination, and strengthening their ability to appeal. all in close coordination with health services and decision makers. We have also worked with military institutions on issues of new masculinities, sexual rights, reproductive rights, and safe abortion in order to transform sexist behaviors and create new men. The policy area socialized the constitutional ruling. This process of raising awareness and training was accomplished through workshops given to key stakeholders involved in the critical attention route and response to sexual violence, whose responsibility is to receive and promote the denunciation of the crime of rape. These key stakeholders were represented by the Public Ministry, the Bolivian Police, the Municipal Comprehensive Legal Services, the Ombudsman for Children and Adolescents, and the Plurinational Integrated Justice Service. The purpose was for them to have full knowledge of the ruling, its scope, effects, and the obligations arising therefrom, and above all, to eliminate existing barriers towards the compliance of this regulation. These actions aim to promote a process of accountability before the right of women to access safe abortions. The communication strategy supports all three program areas through different means, such as social media, radio, mobile messaging, and information, education, and communication material. This strategy has contributed throughout the intervention model for our target population and general population to be informed about the ruling. We reached as large a proportion of the population as possible with key messages to sensitize and inform these populations to achieve the social decriminalization of abortion and for women to know about their right to decide and access a legal abortion. The socialization of the ruling carried out by the three areas and through the communication strategy promotes women's access to legal abortions in a quick and timely manner and allows women to exercise their right to decide as a result of this synergy done on their behalf. With this integrated intervention model, Bolivia has taken a giant step forward, where in the 40 years the criminal code has been enforced, only 7 abortions with judicial authorizations were performed. And since the constitutional ruling eliminated the judicial authorization, 106 abortions have been performed. While at present, the constitutional ruling is an important advance that allows access to safe abortion on 3 grounds and constitutes the fundamental basis for a comprehensive intervention in the 4 areas as mentioned, Ipas Bolivia has continued its tireless work to influence national legislation in order to achieve the decriminalization of abortion, and this is why we are currently working on eliminating abortion from the criminal code, which would mean the total decriminalization of abortion. Another area of work which has the same purpose is the law on sexual and reproductive rights, which is being promoted by indigenous women's organizations and Ipas Bolivia. The implementation of projects under the Ipas Bolivia integrated intervention model has been challenging to the team. We've gone from working in isolation to a strong institutional work culture and team cooperation. It is important to highlight that timely monitoring and evaluation has aided in comprehensive decision-making. This great leap was also possible due to project funding that was not solely focused on the health sector, as in the past, which has allowed a coordinated effort between the 4 areas, generating a wider coverage addressing strategic elements which contribute to achieving safe abortions and ensuring a transparent and effective implementation of funds. We are aware that this was just the beginning, but this intervention has opened the window of opportunity to make the institutional mission a reality under a new approach that can contribute to a global strategic plan with an integrated vision.